There are many sexually transmitted infections whose symptoms do not show in most people. However, they eat up the body internally, silently, and end up killing the whole system. Today, KAREEM'S clinic presents to us a disease, gonorrhea. Now, gonorrhea is an STI, meaning it is sexually transmitted. It is caused by a bacterium, so it means it is a bacterial infection. So this bacterium that causes gonorrhea is called Neisseria gonorrhoeae. The bacteria infects both males and females. It majorly affects urethra or the rectum or even the throat, depending on the part that was used for the intercourse. If it is oral intercourse, then it will affect the throat. If it is the normal intercourse, it will affect the urethra. If it is the anal intercourse, probably it will infect the rectum. In fact, in females, it even affects or infects the cervix. It is very common and rampant among young people aged 15 to 24. And nowadays, it is worth noting that because of high rates of immorality, it affects all age groups as long as you practice an intercourse with more than two partners and more than one partner, and the intercourse is not protected. It can be spread through the three: having a vaginal intercourse, an anal intercourse, and even an oral intercourse with an infected person. A pregnant person can also infect their unborn baby during childbirth. And that is why it is very, very important that when a woman is pregnant, you need to get correct examinations, testings, and even treatment, and you need to know your status. So when you are pregnant, make sure you do clinical checkups. What are the symptoms of gonorrhea? The most women actually do not have symptoms. So we are going to look at symptoms in women and symptoms in men. And then we also look at those symptoms that come at the points, at the organs of the intercourse. For women who show symptoms, you will have burning sensation during urination. Apart from this, watery or creamy green or yellow discharge. You will experience that. And now the funny part of it is the creamy yellow or green discharge usually gives a bad odor. It has a foul smell. Bleeding between periods can always be experienced by a lot of women. Also, pain, a very sharp one in your belly. Fever accompanies gonorrhea. So when you have gonorrhea, apart from these symptoms, you'll always experience fever as well, and that urge to urinate more frequently. Though the urge to urinate more frequently also happens in other UTIs, and of course gonorrhea, in as much as it is an STI, it also affects the urinary tract system, system. So pain when having an intercourse is another one for women. So when you are having an intercourse and you have that pain, the pain could be as a result of a lot of things. But if you conglomerate all these symptoms, you may end up arriving at a possible gonorrhea infection. In men, there is that burning sensation again when you pee. The testicles may be or could be painful. So if you are having a burning sensation and you realize your testicles are painful and swollen, and you also see white or yellow or even green discharges from the manhood or the penis, for those who have foreskins, the foreskin would always swell or get inflamed, and fever is a very common symptom when someone has gonorrhea. So that is for men. Now, if it happens to infect you within the rectum, that means there was an anal intercourse involved, then you will have anal itchiness. The anus will always be itchy. You will experience soreness, probably an ulcer within the anus. You will also see blood in your stool and pain during bowel movements. When you are defecating or you are relieving yourself, the long call, you will feel a lot of pain. Now, if this comes after the anal intercourse, then there is a likelihood that gonorrhea could be present. That happens when you don't use protection, when you do unprotected sex. And remember, the only way to protect yourself from such infections is either use a condom or have one partner and be faithful to that one partner, or just abstain. Now, for those who do oral intercourse, I'm assuming it is the lady that is getting infected because the oral intercourse especially affects women. So if you have persistent sore throat, don't ignore. If you've been having an oral intercourse and this sore throat keeps coming back again and again, don't ignore. If you have redness in your throat, something that feels like tonsillitis that we just saw in our previous video. So if you have inflammation and redness in your throat, again, always suspect gonorrhea, especially when you did unprotected sex. Of course, the oral sex can't be protected. I mean, the male counterpart can't have a condom and use that for oral intercourse in the mouth of their female counterparts. That is ridiculous. Also, the swelling in lymph nodes in the neck, which can always show that this indeed could be gonorrhea. So, what am I saying? I'm pushing this point deep down our brains that an intercourse, be it oral, be it anal or just the normal or the vaginal intercourse need protection, especially when you're meeting somebody that you rarely meet, or somebody whose health condition is not sufficiently known to you. Make sure you protect yourself using a condom. And I'm saying this because a lot of people have this infection and they think probably it is just the normal tonsillitis. They think it is a recurrent or chronic or an acute tonsillitis, yet they have gonorrhea. What is the end game to this? When you have gonorrhea and probably the symptoms are not really dire, eventually the body will be overwhelmed and you could find yourself collapsing. Or some people even die. And when this bacterium stays in the body for long, then it keeps mutating or it keeps changing its genetic structure. And the longer it stays, the more difficult to treat it becomes. So it therefore means that if you're not treating this disease early in advance, then it could cause you more and more problems. So what tests can you do to find out if you have gonorrhea? So you can do urine tests. In urine tests, gonorrhea can be detected. You can also have a sample of your fluid tested. Now, if for men, you can do a penis swab. This swab is cultured. There is a process known as culture of bacteria. So when the swab is taken from the penis, or a vaginal swab, or even a rectal swab, or even throat swab, so the swab is taken, that means the fluid around those areas is taken. That fluid is cultured. A culture is done on them. A culture is simply putting that swab in a favorable condition for any bacteria in it to grow. And the bacteria, upon growing or upon growth, is studied, and we find out, is it this bacterium that causes gonorrhea, called Neisseria gonorrhoeae, or it is a different other bacteria. The good thing with culture is it will give you the exact bacterium that we are talking about. If it is not the bacterium that causes gonorrhea, it will give you the exact bacteria that probably is causing that problem that you are seeing. You can also have blood tests. You take the blood and culture the blood to find out whether the bacterium that causes gonorrhea is present. Now, as I've told you, in women, if it is left untreated, it can lead to pelvic inflammatory disease, what we call a PID. Now, a PID, or pelvic inflammatory disease, is so painful, very painful. It is actually, it causes severe pain, and the pain could be so chronic. Chronic means you can have pain for over a very long period of time, and it can also cause damage to your reproductive organs. So chances are, if you have prolonged gonorrhea untreated, then you may find it very difficult to get pregnant. And if you get pregnant, chances are that you may have what you call an ectopic pregnancy. An ectopic pregnancy is this pregnancy that grows outside the uterus. It grows along the fallopian tube. In other words, when fertilization takes place, when the sperm runs towards the ovum and meets the egg along the fallopian tube, then the implantation happens there. Growth of the fetus begins, of the zygote begins right there, and it does not get swept into the uterus. It remains there. And you know what happens next? If a pregnancy grows on the fallopian tube, then the fallopian tube can never carry pregnancy. It therefore goes without saying that the zygote will grow. Upon growth, the fallopian tube will burst out, and that endangers the life of the pregnancy carrier, the mother. So make sure you treat this with a lot of caution. Any tiny symptom, especially when you are aware that you had unprotected intercourse, could you kindly get checked? What are the treatment? Usually, this gonorrhea has treatment. However, the recommendation by the World Health Organization initially was an injection and then the use of azithromycin. But now azithromycin, some people call it azithromycin, others call it azithromycin. Now azithromycin has been phased out because of the resistance. The gonorrhea has restructured its genetic makeup so that azithromycin can no longer treat it. So you can always have a one-time intramuscular injection of antibiotics known as ceftriaxone in your buttocks. Now intramuscular is that one that you are given on your buttocks, together with tablets that your doctor will prescribe for you. There are a lot of tablets, there are a lot of antibiotics that can treat gonorrhea. Also, you can always have doxycycline twice daily for 7 days. Sometimes these same symptoms present themselves as gonorrhea, but still it is shared. Also, chlamydia also has almost the same symptoms. So doxycycline can always treat both chlamydia and gonorrhea. So once again, do not misuse antibiotics. Ceftriaxone here is for injection, intramuscular. Azithromycin, as I've said before, has been phased out because of the resistance. It doesn't mean azithromycin is not in the market. It is in the market. It can be used to treat other diseases because it is an antibiotic. It is 1 times 3. The dosage is 1 times 3. I mean 1 times 1 for 3 days. That is 1 times 1 for 3 days. It means you swallow it today, tomorrow, and the day after tomorrow, and that is a complete dose. So it can treat other diseases, but not more often, not gonorrhea. So that is what KAREEM'S Clinic had for us today. Kindly, if you find this information useful, help us grow the channel. Consider subscribing. Turn on the notification bell. And I wish you the best of health. If you have any questions, you can always direct them to kareemsclinic@gmail.com. Thanks for listening.